Good evening, and thank you for joining us tonight for our Star Vista Parent Caregiver Education Workshop. Tonight, our workshop is called Mental Health 101. My name is Adrienne, and I work at the San Mateo County Libraries. San Mateo County Libraries strengthen our community by creating an inclusive environment for learning. While we can't meet together in person at this time, we hope that these collaborative workshops will continue to foster community among families during this unprecedented time. Thank you for being a part of our community. This program will be recorded and shared through various San Mateo County Libraries outlets, including third-party websites like YouTube or Facebook, so others can learn from this engaging experience at a later time. You will not appear in the video, and you will have the option to remain anonymous or sign up with a nickname. Don't worry, you can still interact with us using the chat function. We are thrilled to be partnering with Star Vista, a nonprofit organization that has been helping people throughout San Mateo County navigate life's challenges for over 50 years. Their counseling, crisis prevention, youth housing, and outreach programs reach tens of thousands of people in our community each year. So without further ado, I'd like to introduce you to our presenter this evening, Vero Polanco from Star Vista.
Awesome. Thank you for that intro. So hi, everyone. My name is Veronica, but you can call me Vero. I am the Youth Outreach Coordinator for our Star Vista's Crisis Center, but our long title is Crisis Intervention and Suicide Prevention, but we just call it the Crisis Center just to keep it simple. I'm very excited to be here. So we are going to be talking about mental health. Specifically, we're going to be talking about some common mental health disorders. We're not going to talk about all of them because we only have, I think, like 45 minutes to an hour. So I don't want to keep you all for that long. And let me share my screen. That is okay. All right. So like I mentioned, I am from Star Vista. Star Vista is a nonprofit mental health agency. We have about 30 different programs in the county of San Mateo. A lot of our programs are free or very low cost. We have services such as counseling, we have drug and alcohol treatments, we also have enrichment classes, and then there's the Crisis Center, which is where I am from. So the Crisis Center, we have a few main services. The first one being the crisis hotline. We are actually directly connected to the National Suicide Prevention Line, which is pretty amazing. So if you are calling the 1-888-62-8945, you will be directed to our crisis hotline if you're calling from a 650 number. And our hotline is open 24 hours a day. So maybe it's 2 a.m., you can't sleep, you need to get something off your chest. You can totally call us. Our volunteers are amazing. They go through an extensive amount of training. So they're able to support you in any situation that you are in. And if you feel like that we aren't able to support you, we will refer you out and connect you with additional services. Another service we have is the Teen Chat service. This is geared towards the youth, specifically in the county of San Mateo. So the website is onyourmind.net. It is peer-to-peer counseling. So maybe if you have a niece, nephew, or maybe your child, if they're at least 14, they could become a peer counselor. I think this is a really great opportunity for our youth and students. I wish I had this available when I was in high school. They really get to interact with people from all over the world. We have people from Canada, Mexico, we have people from the UK, everywhere, just literally utilizing our services. And the last program that we have is the Health Ambassador Program for Youth. So this is a very incredible program. This is for 16 to 24-year-olds, where youth learn about mental health. They learn about their own mental health and how to support others who are maybe experiencing some difficult times. After 3 months, they go out and they get involved with the community. They present about what they've learned, or they could assist me in presentations because my role is to present to different high schools about mental health and suicide prevention. So when students are done with the training and 3 presentations, they will get paid $700, which is amazing. So if you have students or children that are interested in maybe becoming a therapist or even majoring in psych, this is a really great opportunity for them to get their feet wet. So today we're going to be covering a few topics like I mentioned. We're going to talk about mental health and stigma. We're also going to be talking about common diagnoses, specifically ADHD, anxiety disorder, and depression. We're also going to talk about how we can find support and how Star Vista can support you as well. And I do want to mention some of these topics can be a little heavy or a little triggering. So if you need to take a break, please do so. Self-care is very important. Okay, if you need to go drink some water, please do so. If you need to leave the virtual session, please do so as well. So the first topic we're going to talk about is mental health and stigma. So this is sort of like an interactive piece. So if y'all can answer, that would be amazing. So what comes to mind when you hear mental health? And we will view the chat if we are able to. Let's see. Stress, definitely, right? So stress comes to mind whenever we hear mental health. Thank you for participating. Anything else come to mind when you hear mental health? A lot of the times when I ask this question to parents or to students or community members, they say stigma, they say maybe crazy. There's a lot of negative misconceptions surrounding mental health, right? Cardio and mindfulness techniques, awesome. Yeah, that is definitely something. Anything else? Others can be maybe like suicide, anxiety, depression, maybe taboo, because I am Hispanic or Latinx, and in my culture, we really aren't allowed to talk about mental health. So a lot of stigma and taboo. Someone else mentioned loss of control. Yeah. Something many people deal with alone. Culture can be challenging when acknowledging mental health. Yeah, it definitely can. Like something is going bad or wrong. Yes, exactly right. Awesome. Thank you all for participating. I love it. So what is mental health, right? So mental health refers to the well-being of our mind, right? It includes emotions, thoughts, and psychological well-being as well, okay? And if you all have any questions, please let me know. You will not interrupt me at all. So when we do talk about mental health, there is a lot of biases, right? And it could come from cultural factors. It could come from like religion maybe, or it could just be from like word of mouth. It can also come from social media. Social media is pretty big right now. And it may come from other people. So in order for us to be well or our children well, they need to have an amazing like wellness wheel, right? So every element on this wellness wheel needs to have some sort of love. So when we refer to the elements of wellness, there are 7 different ones, specifically spiritual, emotional. There is also intellectual, physical, social, environmental, and financial. So some examples of emotional could be being able to distinguish how you're feeling and being able to talk about that, right? Intellectual is learning new things, engaging in new activities that you haven't done before. Physical could be exercising or eating well, sleeping, making sure that you are managing your stress as well. I'll slow down a little bit because I tend to talk really fast sometimes. Environmental could also mean taking care of like your plants outside, right? Or maybe decluttering your room, recycling, cleaning up the environment. And spiritual could be beliefs, values, any ethics that help you guide your life, right? Or choices that you make. It doesn't necessarily need to be religion, but it can be. All right. So now what is stigma, right? So when someone is being told something negative, right? for example, any sort of stigma, people can feel shame or disgrace, right? Or they can feel embarrassed, overwhelming, like they can't get through it. It could sound like, oh my goodness, you're just so dramatic, right? Or people like us don't talk about this. Or it could be just get over it, right? Or you don't really mean that. So stigma is not great. For example, I myself have severe depression and I have severe anxiety. And I remember I never told my parents like what was going on because I didn't want to be stigmatized. I didn't want to be judged. I didn't want to be labeled as crazy or someone who is just trying to get attention. So that definitely deters individuals from opening up for help or asking for some support. Okay. And if you have any questions, please put them in the Q&A. You will not interrupt me. So the next topic we're going to move into is common mental health disorders. Now that we learned a little bit about mental health and its stigma, let's talk about the most common diagnoses. And I do want to remind all of y'all that I am not a mental health therapist or a doctor, so I cannot diagnose anyone, but I am here to listen and support you if you need any type of support. So what is mental health diagnoses? A health condition that affects the way a person thinks, the way they feel, right, emotions, or how they behave. It could also affect the ability to go to school, go to work, participate in daily activities, and maintain healthy relationships. This can affect our young people especially because there are so many changes right now. For example, COVID, pandemic, transferring or moving from on campus to virtual classrooms, which can be very different. And then maybe it could affect them talking to their friends or replying to the group chats or creating healthy relationships. And in the bottom left corner, you will see that it says must be diagnosed by a professional. We highly recommend, or we want you all not to diagnose someone if you aren't a professional or yourself. So don't go to Facebook or maybe Wikipedia to diagnose yourself. It's very important to talk to a clinician, a therapist, a psychiatrist, or even go to your doctors. For example, say you have the flu and you go to your doctor and you let them know what's going on. You can definitely go to your doctor and let them know, hey, I haven't been feeling emotionally well. Like what are my options to gain or get some support? So here are the list of common disorders. I'm only going to go over the ones that are bolded. So attention deficit and hyperactivity disorder, ADHD, anxiety disorder. We are going to distinguish between what is anxiety versus anxiety disorder, and then depression, right? And other common disorders are eating disorders, psychosis disorders, substance use disorders, trauma and stress related disorders as well. So to start off, attention deficit and hyperactivity disorder. So this is a disorder where it's characterized by inattention. It's really hard to stay still. You exhibit a lot of impulsivity, right? There is no single test that can diagnose a child with ADHD. So it's very important to communicate with your child's doctor or with a doctor or a mental health professional, right? To get as much information as you can. People with ADHD may have problems paying attention, controlling impulsive behaviors, or they can be excessively active, right? Treatment, possible treatments can include medication or behavioral therapy, right? So for behavioral therapy, a mental health professional can help a person find ways to improve their behavior. For example, a doctor can provide guidance on how to organize and complete different assigned tasks. And they could also help individuals learn how to deal with frustrating events. And then behavioral therapy can also help improve social skills. I know this is a lot of information, but I promise you all will have the information on the website. So moving on to anxiety, What is anxiety? Anxiety is the mind's and body's reaction to stressful, dangerous, or unfamiliar situations. It's the sense of uneasiness, distress, or dread you feel before a significant event, right? So it's really important to recognize that everyone does experience anxiety. It's normal and necessary, but it's very different from anxiety disorder. So what sets it apart is that a certain level of anxiety helps us stay alert, but for those suffering from anxiety disorder, it feels very far from normal, right? It can be completely debilitating. So for example, anxiety disorder, you have to look at how long the symptoms are lasting, the severity of it, and how it interferes with your daily activities. So as I mentioned before, I myself have severe anxiety, and I knew something was going on when I was constantly worried. I was constantly going to social places. I also wasn't able to sleep at night because I had so much worry and fear going on, but I couldn't really pinpoint where it was coming from. And if you all have any questions about my own personal experience, I am totally open to talking or sharing with y'all. Somebody asked, is it common for one with a mental health disorder to be reluctant or uncomfortable in seeking professional help at first? Most definitely, right? When I started feeling these symptoms of depression and anxiety, it took me about 5 years to actually reach out for help. I thought that I didn't need any help, so it was very uncomfortable for me to actually go to my doctors and say, hey, I think there's something wrong. I haven't been sleeping. I'm always sad. And I'm thinking various negative thoughts as well. So great question. So now we're going to go over some symptoms of anxiety disorder. So those include physical, psychological, and behavioral as well. So some physical symptoms include fast heart beating, chest pain, right? You can feel some tightness in your chest. You could have an upset stomach. You can feel nauseous. You could also vomit, right? And then trouble breathing. You could also experience pain or discomfort in muscles. Psychological include difficulty concentrating, impatient. You can feel very confused as well, or disturbance in sleeping patterns, right? So that's something that I mentioned. Maybe you aren't able to sleep at all, so you're experiencing a lot of insomnia. You can feel very irritable and angry. And then you can feel indecisive as well. Moving on to the behavioral avoidance of situations. For example, maybe not going to the mall because you get really, really overwhelmed and you have all of these emotions of fear, your stomach starts hurting, all of that. Compulsive or obsessive behaviors, social anxiety, debilitating or excessive fear. And increased use of substances, right? So alcohol or drugs to deal with whatever you're experiencing. Other examples could include fear and worry about your own health and the health of your loved ones. Maybe your economic or employment situation, especially now because we are living in an extremely stressful time. You may notice that I'm pausing quite often. I want to make sure that I give you all time to process all of this information. So moving on to the next one, depression, what is it? It is a health condition that negatively impacts the way we feel, our emotions, the way we think, and how we behave, right? It's not uncommon for someone with an anxiety disorder to also face depressive disorder, right, or symptoms, or it could be vice versa. So almost half of the people diagnosed with depression are actually diagnosed with an anxiety disorder. So depression is a mood disorder. What that means is that it can influence the way someone behaves, right? Their emotional state shifts quite often. And when they have a depressive low, they can have a really severe one. So there are days where I'm completely fine. And then all of a sudden, like out of nowhere, I get hit with like a huge wave of like negative emotions or like sadness. And I'm in that wave for about a couple of days up to about a week and a half. Once I'm out of that wave, I am extremely exhausted. I'm mentally, physically, spiritually tired. So I definitely need to take like a day off from everything just to recuperate. It is treatable, but needs to be diagnosed by a professional again. Professionals, this is something that I stress, especially to students, don't self-diagnose yourself. Talk to a professional, talk to counselors, talk to therapists, talk to psychiatrists, right? It's very important that you seek that help. Depression can arise from different things. For example, environmental stressors, maybe you experience something traumatic, so that sets it off, or it could be biological, right? It's passed down from family members. Any questions so far? All right. So now in the Q&A box, if you guys can, I want you all to think about what are some symptoms of depression, right? So if someone is diagnosed with depression, how could they be feeling? What could be going on physically? For example, emotionally is feeling sadness for X amount of days. And then physical could be maybe change in weight because your eating habits change depending on your emotional state. So take about a minute and you guys can enter your responses in the Q&A. That would be great. Someone said wanting to stay at home and be less social. Definitely. Sleeping all day. Yes. Anything else? Any other ones? And if not, that is totally fine. Not talking to friends or family. Yes. Wanting to watch lots of TV. Yeah. So trying to distract yourself. Stop eating instead eat more. Yeah. So your appetite changes. Definitely that is a symptom of depression, right? Maybe you're not eating enough or maybe you're overeating. Perfect. I love how interactive you guys are. Someone else mentioned crying all the time. Yes, right? All right, so now let's see. You all probably covered half of them, so great job. So symptoms of depression, these are just common ones that we see. We have a huge list of other symptoms of depression, but we just didn't want to put it on here to overwhelm y'all. But these are the most common ones that we see. Feeling sad, feeling empty, loss of energy. You don't have energy to get out of bed. You don't have energy to get ready or even go to work virtually. And then change in sleeping patterns, you're oversleeping, or maybe you're not getting enough sleep. And then you could lose interest in previously enjoyable activities. So for example, say a student really loved playing soccer, they watched it, they talked about it all the time. And then all of a sudden they're just like, no, I don't want anything to do with it anymore. And if they don't replace it with something else, then that is something that we need to take a look at. Inability to concentrate as well. Grades can be affected, performances can be affected, feeling agitated and angry, and feeling like you're not good enough or you're worth anything. And then risky behaviors, right? So some examples of risky behaviors can include crossing the street without looking, drinking and driving. It could be risky sexual behavior as well, having multiple partners and not using protection. And then self-injury or self-harm. So those are all risky behaviors. So anything to put your life at risk. So how do we start a conversation? I know it can be really hard to have a conversation. I am a mom, I have an 8-year-old son. And so I'm trying to establish different ways to communicate with him and letting him know that, hey, it's okay to tell me something if you aren't feeling well. So things to consider is just listen. I know a lot of the times as parents or caregivers, we want to find the solution or we want to find the answer. But at this point, we just have to, listen to them without judgment. Also comment that expresses support, not shock. Because if we express shock, it could kind of throw the student or the youth off, right? And avoid comments or questions that pass. And comments that express concern and do not minimize their emotions. For example, we try and avoid saying, oh, you don't really mean that, or you're going to get over it, don't worry, or there are people who are worse off than you. That's definitely minimizing emotions and not validating how they are feeling. And then open-ended questions are amazing. Don't ask, why this, right? Or do you feel sad? Their response could just be like, yes or no, right? We kind of want to ask, hey, like, what's been going on, right? What's been changing your emotion, right? Why are you feeling so sad? All of that. So some examples, I'm worried about you. Is there something that I can support you with? I've noticed you seem sad lately. How are you feeling? Is there something going on? And actually my go-to with my 8-year-old son is tell me more, right? So my son sometimes will say, oh my gosh, I'm so frustrated. I'm like, okay, tell me more, right? Tell me more about what's been making you frustrated. Tell me more about what's been keeping you up. And if my 8-year-old can open up, then I'm sure other students will be able to. Someone asked, all great tips here. Thank you for sharing your experience on risky behaviors. Might we have information on how this generally affects school-age females versus males differently? Yes, so I will grab our resources and I will send it to Nicole and she'll be able to pass along the message. Awesome. Thank you. You have another question? Oh, of course, you're welcome. Someone said thank you. Any questions so far? And another thing I do want to mention is that I know as parents, we kind of feel like we've gone through a lot in life, I guess. We have so much experience. We want to make sure that we don't minimize, I guess, like what our student or what our youth is going through. Even if it seems like the smallest thing, like just treat it as if it's very important, right? Because it is important. It could be as small and it could be super big. Just treat it all the same, right? Come from a place of care, right? Make sure that you aren't judgmental. And again, remember, you are not alone. I know it could feel really isolating or it could be really hard, especially given the circumstances right now. But you are not alone. We have resources to give you all. Listen to your child or youth without judgment again. Listen to understand them, right? And not listen to them to respond. And believe them as well. Validate them. Let them know like, oh, I can't believe you're feeling this way, right? Like, I'm sorry that you're feeling this way. What can we do together? Or how could I support you? And it is okay to ask directly about suicide. So this is something that we always have on here because I work at a crisis center and it's in our title as well. If students are exhibiting multiple symptoms, say, for example, multiple symptoms of depression, they can feel really isolated, right? They can feel like they are in crisis. So it's always safe to ask if they are having thoughts of suicide or thoughts of killing themselves. And this is another topic that I can spend like an hour talking about. So if you all would like that, maybe I can connect with Nicole. So how do I find support? Talk to a person that you trust. Maybe you have a best friend, maybe you have a colleague. School admin is very important too, and staff members. Growing up, my mom had a really great relationship with one of my teachers. So that was always good. She kept tabs on me. Talking to your primary doctor, also calling the crisis hotline again. We are amazing. We are incredible. We're nice. We want to support you. So you can totally call us. We're open 24 hours a day. And then calling the access line, right? If you have insurance or you don't have insurance, the access line will be able to provide you support, right? Typically, those who don't have insurance, we will connect you with somebody else who will be able to support you. And here are some resources for you all. If you want to read more about teen mental health, this website is amazing, teenmentalhealth.org, Our Vision. You can also look up NAMI, which is National Alliance on Mental Illnesses. You can learn about how to interact with your child, how to have a conversation. Then you could also utilize National Institute of Mental Health. And then again, our plugin is Utilize Us. You can totally call us. Or if your teen, maybe they don't want to open up, maybe they don't want to talk to family members, they can totally log into onyourmind.net and talk to another high schooler from the county of San Mateo. And I love this little image right here on the last slide. It's okay to not be okay. It's totally fine. Just like when you let somebody know I'm not feeling physically well, you can let somebody know I'm not feeling emotionally well, and that is totally fine. Questions, comments? Thank you all so much. We also have contact information at the bottom left corner. CAPS is amazing, part of Star Vista. They support families, they support parents and children, or Crisis Center as well. And if anybody has any questions, please ask. I am here. Although I cannot give you professional diagnoses because I am not a therapist. Oh yes, and I totally forgot. Thank you so much for reminding me. We also have a survey that we would love for you all to fill out. Let me stop sharing my screen so I can retrieve it. So if you all could fill it out, that would be incredible. It's just to give us any feedback or tips on anything. Maybe I didn't give the greatest presentation. And if I did, I'm so sorry. Where is it? All right, so I am putting it in the link. It should be like a 1 or 2 minute survey. You don't need to identify yourself, totally anonymous. You're just giving us general feedback. Q&A. I've learned so much. Thank you. This was great. I don't have insurance. Where can I go? Any free help? Yes. So I can definitely connect with you. All right. Any other questions? If not, thank you all so much. Someone asked, is there a way to listen again to the session? And yes, I believe Adrian mentioned that it would be on Facebook and YouTube. I think that was it. Adrian, would you like to add anything?
Yes, thank you, Vero. Thank you so much. So, if nobody has any other questions, then I'm just going to say thank you for joining us this evening. Before you leave, please take a moment to complete the survey if you can. This is one of a series of parent caregiver education workshops led by Star Vista. So this workshop has been recorded as was asked. It'll be available on the SMCL YouTube channel for those who may not have been able to attend tonight, or if you'd like to revisit any of the resources that Vero mentioned. And if you're interested in attending future workshops in this series, please visit our website, which is www.smcl.org. Thank you very much and have a good night.